Hello, everyone, and welcome to this discussion about transformation at the heart of healthcare, introducing a loving organization. My name is Henrietta Suturis. I'm a neuroscientist, mental health consultant, and entrepreneur, and I will be moderating this event today. So we should be live on LinkedIn and YouTube. So I would like to ask the audience to please put any question or comment you may have in the chat, and we will respond to them during the live. I am currently the founder and CEO of Objective Recovery, a digital platform where we help people find the best personalized solutions to addictions, substance use disorders. Please feel free to connect with me on LinkedIn. I've spent my entire career in health related research and innovation and worked for several large healthcare organizations in different countries. So I am intimately familiar with the problems plaguing these systems. Because of this, I am very happy to collaborate with this new consortium called the Loving Organization. And we'll now invite the first speaker, Dr. Apurv Gupta, to introduce the project. Apurv, please take
Wonderful.
it away.
Yes, thank you so much, Henrietta. This is extremely exciting. Thank you for coordinating all of this for us. Thank you for all of the audience members to take some time out to participate in this. I'm Apurv Gupta. I'm an internist by background. I worked as a hospitalist for many years and a medical director for a hospitalist group, as well as chief medical officer at a couple of different community hospitals, all in the Boston region, before coming into consulting about 10 years ago where I help to lead now a lot of care transformation, quality transformation activities, which have really led into this work that I'm excited, we're all excited to be introducing to you today. The gist of it is, as you see, is we call it our loving organization. And we have created this consortium that we're officially launching with you here today to help put some more focus and bring resources to bear, help to create some of the definitions and standards that we would need. And you really welcome your participation in the process. So this has been much awaited. Many of us have been working on this for, in some capacity or the other, for the past year to bring this to life. It's really remarkable to experience this energy, the momentum that is building, and particularly to see how committed people are in bringing more love to healthcare. It's really the mission and the vision that many of us went into healthcare with, and I think many of us are feeling renewed and rejuvenated in that prospect. Our vision for the consortium is to bring more love and compassion into healthcare in our society through the creation of loving systems throughout our organizations. And our mission is to really create a vehicle for multi-stakeholders to participate, collaborate, and brainstorm ideas, concepts, and tools, thought leadership related to supporting the loving organization work. Today, all of you are going to share in the excitement, learn about what we're trying to accomplish, and we hope that many of you will also decide to join the consortium in some capacity. I think this consortium has the opportunity to be like no other, in that it's not only our mission to create more loving organizations, but ultimately to create a loving consortium itself in the way that we manage ourselves autonomously, without hierarchy, and by emulating loving management practices. And at the same time, we as individuals are also becoming more loving in the process as we learn more about what love is, how to model it, and how to benefit from the influence of each other in how to bring it into our day-to-day lives. So I hope you'll share with me the excitement that loving organization has the potential to drive improvement systems, and one could argue other social systems as well, by inspiring all of us to manage with love, not fear, showing us that it's possible to do so, and that doing so leads to great outcomes all around. So I want to take a moment to thank our charter members and the strategic advisors who have gotten us to this stage, and to all of you who have been blazing the trail for us to follow. A special thanks to you again, Henrietta, for organizing this event. And thanks to all of you for making some time to learn more about this initiative. I think with that, you can see the agenda that's displayed here on the screen. I'm not going to read it for you. I will turn it over to our next speaker, David.
Hello, hello, hello. I'm David Dibble. I'm the creator of loving workflows in 3D healthcare, which are basically models for creating transformation, systematic transformation in healthcare, particularly at the level of care delivery. So this is where we sort of save staff and patients from the rigors of fear-based systems. First slide, please. So I want to talk to you a little bit about systems and workflows. And what I'd like you to do is to just sort of suspend belief for just a moment or two as we go through these truths about systems and workflows. I think you'll find some of these things are not really familiar, but if you do a little research, you'll find out that these are actually true and accurate, and will become part of what we think is really important for a loving organization, which is loving systems and workflows. So here are some truths about workflows and systems in healthcare. 94% of outcomes are in the workflows and systems, not the efforts of staff. Just this one thing by itself changes pretty much everything that we've probably been thinking about as far as the problems that we're experiencing in healthcare. 20% of the workflows create 80% of the problems and stress. So we only want to work on the critical few, not everything. Workflows are 50% systems and 50% people, and each are equally important. You can't go in and fix just half of it. You've got to actually work with the whole. Fear and stress create the workflow, bad workflows and bad outcomes. And love and caring create good workflows and good outcomes. This is important. Only staff collectively can change fear-based workflows to ones based in love. And finally, only a non-directive change model based in love is sustainable. Next slide, please. So a little bit about fear and stress-based workflows and systems in healthcare. Quality of care goes down. Safety goes down. Patient experience goes down. Productivity goes down. Staff burnout goes up. Staff turnover goes up. Costs go up significantly. And for the people in the C-suite, profits go down. Everyone loses, including patients, staff, families, communities, and eventually even the C-suite. Next slide, please. So talking a little bit about loving and caring workflows and systems in healthcare. Of course, it's the exact reverse of the ones that are created in fear. Quality goes up, safety goes up, patient experience goes up, productivity goes up, staff burnout goes down, staff turnover goes down, costs go down significantly, and profits go up. Everybody wins, including patients, staff, families, communities, and the C-suite. So, everything is connected. This is the thing about systems. All systems are connected. We're all connected. And so this idea that, playing win-lose actually is a myth. Everything's connected, so the only two games we can play are win-win and lose-lose. And so creating loving workflows and loving systems allows us to begin to play the win-win game. Next slide, please. Okay, we're taking a look at models for change. We know that in healthcare, there have been all sorts of systems-based models for change that have been introduced over the years. We have also seen that there's been a basic failure of almost all of them. So let's take a look at what we would need to see to change in those change models in order to create loving workflows and loving systems. First of all, they have to be based, the model itself has to be based in love, not fear. That means it has to be non-directive. It's safe for all team members. It uses a love-based pull strategy rather than the current push strategy where people are being directed to, try and do better. It has to be 100% voluntary. It has to allow, this is important, you have to allow only caring and loving people who care about others on the team. You can't bring fear into the teams who are going to be doing the systems change work. And this is important too. It has to start with emotional data. Basically, the stresses that have been passed on from the systems to the staff who work in those systems. And so we start with that, and we basically reverse engineer that stress back to the systems that created it. And now we're working on the critical 20% of the systems that are creating 80% of the problems. This is important too. The model must heal staff who implement it. This is, we find that taking care of the people half of the integrated whole requires that we actually are beginning to heal the people that are on the edge of burnout or that are suffering from the stress that the systems are passing on to them. And then finally, it has to be, excuse me, simple, easy to learn and use, both from a problem solving and a loving management and leadership model position. So not complex, actually very simple, and can be applied both in problem solving and in management and leadership. Okay, that's it for me. Apurv, shall I see if there's any questions around this particular presentation?
So I don't see any audience questions, so I think we can just move on to the next speaker. Apurv, please start yours.
Sure. Yes, thank you. And luckily for everyone, I already introduced myself, so we won't have to go through this. I want to just dig into a little bit more of what David was talking about. I think he's really introduced a lot of our principles and values, and really set the stage for love versus fear. Really, that's all we think that there is, and that's not even a competition as such. It's just to recognize that either we operate within a fear-based environment or a love-based environment. We've had so much thought process around the terms loving, organization, what we mean by each of these. And there's always so much more that we can continue to debate. And actually, we're happy to get more input about all of this terminology as well. But nevertheless, we don't want to get caught up in the semantics. The reason that we use love is because it sets up a really simple, as David was just saying, a simple contrast between what people are trying to move towards and where we're moving from. Again, moving from fear to moving to love. So let's go on to the next slide, please. This is the gist of the loving organization. We really want to focus on the systems. When we talk about love, we can focus on many different aspects of care. Certainly, all of us, understand love as individuals, and we all value love in our personal lives, in our families, with our friends, and maybe we haven't thought about it in the context of a professional setting. Some of us are comfortable starting to talk about it now. Whereas others are still grappling, with the ideas of, really, are we going to go there? Is this what we're going to talk about? And what we've generally found is that love it opens up the door and, gets people to pay attention, gets people to start thinking a little bit differently, even though you could argue that love also encompasses other concepts such as trust and compassion and respect and kindness, which are also just as important, and any one of them could really embody the other. We feel that love is ultimately opening up the door. It's the essence of who we are, and it represents much more than just an emotion. It really represents our ability to represent the best of ourselves at the core levels into the world, and it recognizes that we're going to try to do this and systematically, not put the burden back on the individual. We know, many of us who are working in healthcare, that our doctors, nurses, and all ancillary staff, leaders themselves, are all feeling very overworked and overwhelmed in many cases. So the goal is not to give them yet another thing to do, but is to help them understand that they're supported in this effort by each other. We really want to call out the organization's culture, the mission, vision, values, the leadership, the tools and the systems, everything that an organization represents that is more than just its people. Because we believe that those other aspects of an organization can go a long way towards creating this environment of love. And really, ultimately, it does this by focusing on systems of management that are actually based on love, which we break down into the simpler dimensions of learning and connection. Again, in contrast to management based on fear, which tends to break down more on control and punishment. So learning and connection is what we'd like to emphasize, and I'll talk about that a little bit more in the next slides. If we could go on. We've also come up with some 4 simple agreements, again, trying to keep the ideas at a relatively simple level, as David was also discussing. We don't want to bring in a lot of ideology and a lot of messages that people have to struggle to remember. Really, the idea here is to first start with an intention of love rather than fear. If all of us as leaders and workers manage this way, we are automatically going to start to see the healthcare paradigm start to shift. Then we want to connect that intention into the purpose of the organization, really weave it in through its mission, vision, values, help the organization understand how it's already woven into their mission, vision, values, and just kind of bring it out. Inevitably, most organizations are probably doing something that that is love, even if they don't call it that. They may call it caring. They may even call it quality. They may call it excellence. They may call it community. And ultimately, at the heart of it, what we're finding is what they're really implying is this notion of love and compassion and caring. And then the next step from that, once the purpose is really aligned and clear, then we want to integrate the work across all of the organization's initiatives, the strategy and the cultural transformation initiatives. What we've generally found is that organizations are actually doing a lot of this work, but they may be doing it a little bit more piecemeal fashion. And so that risks creating more silos and creating more burnout, creating more sense of overwhelmingness. Even though we have a number of good initiatives underway, they're failing to hit the mark because they're not connected. So that's the idea of integration. And then the idea of practice, which brings it all together, is to make sure that this kind of loving approach is woven into all our policies and workflows, that they all incorporate love, that we create daily management systems for loving engagement, for feedback, for communication, collaboration, decision making, and accountability. I think they're just really important to highlight. These are all the ways in which we really manage any organization, of course, certainly a healthcare organization, through engagement, feedback, communication, collaboration, decision making, and accountability. We just think that those mechanisms and management systems can be more based on love rather than fear. Let's go on to the next slide, please. So this axis just really breaks out the whole point of learning and connection being the orientation. We think these are relatively simple for us to understand. We can certainly bring in more dimensions, and some folks have counseled us that maybe there are other aspects missing, such as trust and other aspects that we could also bring in. But again, we've tried to keep it simple. And the way we think about it is that there's either a learning component, which is really more about curiosity, creativity, innovation, and really you could say growth mindset is the interest in learning more and wanting to learn for the benefit of learning, not just for our own benefit. And then when that's paired with the dimension of connectedness, what you really get is the sense of belonging and meaning and engagement, purpose that comes through. And so when these two things come together, you really get a great sense of that community and trust and respect that everybody actually thinks about. And so I think that these are the key ideas. We want to make sure again that the love is a part of the strategic and operational system, and management approaches, which tend to be top down in a fear-based approach, wind up becoming more participatory, inclusive, and generative. And again, we want to focus on the infrastructure of the organization, and the whole point is to create a desirable culture and environment. So again, the focus is more on the organization as a whole, rather than putting the blame on or the burden on the individuals. I think I just have one more slide to come to. And this really kind of brings it all together to talk more about how alignment and integration happens with love. Really, again, what we've found is that often in an organization, each of the bullets that I've listed here on the lower left-hand side of the slide could identifying culture, strategic pillars, employee engagement, patient experience, diversity, equity, and inclusion, leadership development, and technology. All of these things, need to be connected to each other. It's not that we have individuals, leaders, departments, and service lines that are all going to go off and try to do their own thing. But the way that in which love comes through the organization is by making sure that it is actually connected to the strategy, to the engagement and experience pillars, that diversity, equity, and inclusion also connects. So this is what we're really trying to accomplish here, is by making sure that all of the organization's activities really imbue love. In many ways, and with some of our initial clients, what we found is that they don't even have to put this in front of their people. This can simply be something that's operating in the background, representing more how leaders bring all of this work together, so that it can be more powerful for their people. So let's move on, I think, to the next slide. I think that might be our last one. Henrietta, do you want to take questions here or do you want to keep moving?
Yes, so I actually have see one question here from, I will just display it, from Brief Coaching by Hazel Moon. Sorry if I'm not pronouncing it correctly. The question is, if we replace the word love with learning and connection and read this, does it still carries meaning?
I think it does, and that's part of the reason why we really don't want to get caught up in the language itself, because I think even if we do call it learning and connection, one, it's a little bit longer. Two, it's still two dimensions. Each of those dimensions still has to be explained, and even though it carries, in my mind, almost the same meaning, I think that ultimately it will still require us to talk about it. Any of these terms really will require us to actually express more of what we have in mind. That said, we're more than open to kind of continuing to think about what this effort is really about. We want to be able to embody the values and the practices, and we certainly don't want to get hung up on any of the terminology. And hopefully, this is just the launch of the consortium, so this is not the beginning. What we're hoping is that folks like Hassoun and others will join us in helping us think about why are we calling it loving organization, and what else could we call it, and whether it makes a difference to do so. Again, I'll just reiterate why we have come up with the terminology so far is we have found that love opens doors. If we call it a learning organization, well, there's already something out there that's a learning organization. And frankly, there's a lot of overlap with that, but they really don't get to the essence of the loving relationships that we're talking about. And certainly the same thing with connectedness, patient-centered care, relationship-centered care. There's many other initiatives that are underway that have a lot of overlap, but they're somehow also still missing the mark. And so when we've come up with this concept of loving organization, we have found that it's opening doors with clients, with folks like yourselves who are interested in joining us, because I think it's getting us to a deeper place inside ourselves. Again, love is really the essence of who we are. It's beyond just an emotional state, and it's beyond actions. It's really a way of being. And so we have just found that this terminology at this level is probably the most inclusive, but still open to more of thought process around this.
Okay, so I don't see more questions, so I think we can move on to Stephanie.
Hi, all. Thanks so much for being here. We're really excited to have you as part of this launch. I'm Stephanie Feals, and I co-founded and co-host Making Healthcare Work for You with Apurv. And we've had an amazing time over that time with the show. It's now been almost 4 years, getting to know people doing amazing things in healthcare. And over that time, we really kept going further and further into this niche of a group of concepts that we loved, and landed on this loving group of health systems and leaders. And as that, through that came a loving organization. And we're really excited that the show can be part of that as well. Then I also have another show called the Stephanie Feals Show. And I worked in benefits tech for close to 10 years. And through that really developed a bizarre love of high deductible health plans and other things like that. But what made all of that my sweet spot is that after 2015, pre-2015, life was smooth. After 2015, we had all kinds of crazy stuff, a missed miscarriage, a high-risk pregnancy because of preeclampsia. My daughter had to be born because of that 3 months early, and she had a 3-month NICU stay, the first of it sedated on fentanyl and Ativan while on a high-frequency ventilator. Then I had a bunch of family members who had cancer. Some lived, some didn't. And so all of the experience with my background in broadcast journalism, being able to communicate these concepts in a clear, easy to understand way to people and helping them advocate for themselves. And I filled that role for so many of my family and friends along the way, including my daughter, who at that point, born 3 months early, certainly wasn't ready for the world, let alone had a voice of her own. So I really grew to love the world of healthcare. If you would have told me prior to 2015 that my life would probably be consumed by healthcare, I most certainly would not have believed you. But that's how the winds have gone for me. So with that, next slide, please. So the concept of love in healthcare isn't something that is just a wiggly value. It's something that really all humans need and desire. And I personally feel like that's why I love the word love, because it gets to that deep level of human need, and everybody can relate to that in some way or another. So it's not some, creepy feeling or a weird thing to talk about in the workplace. It's something that we're touching on everyone, no pun intended, creepy sounding there, but that makes a difference. So these organizations have gone big with that. Allegheny Health Network is amazing. They have the Share the Love campaign where they have done so many amazing things, but they show the ROI on love to the people within their health systems. They show love to the people in their health system by caring about them. But then they also have shown that the data shows that people often start out high in empathy and then it wanes over time because of all these different things, red tape, burdens, admin duties that they have to do. And so once they show them the data, you can prove that there is a revenue stream through patient loyalty, reduced liability, improved scores, everything that makes a difference and actually does positively impact the bottom line. But something that they said to us really stood out when they were on the show is that you cannot show somebody the data and then not have an action, which is why the loving organization framework is so important, because you have to be able to say, here's what the problem is, and we can help. Everybody can help. There is a role for everyone to play in this. And then another important thing that they said is in this world that we're living in with AI and Google and everything else, you can't dismiss that people do find information on the internet and treat them negatively. We have to show them love by saying, I understand that you've heard this or you've read this. How can we interpret that together? So being a team. And same thing with Peter Pronovost of University Hospitals. He is a pioneer of patient safety, as I'm sure you know, greatly reduced the central line infections and then very into checklists. But he's operationalizing love. He said he goes into every single one of his meetings and uses the word love intentionally so that people can feel that and understand that when everybody feels cared about, you do see results, including in their case, reducing the length of stay from 6.8 days to 1.8 days, and then reducing their annual Medicare expenditure by 33% over a 3-year period. Next slide, please. So these next two are interesting because U.S. News and World Report in May of this year actually said that Hawaii is the #1 state for healthcare, and Hawaii and Alaska, which are the next two slides, are the top 5 for equity. So it's fascinating because Adventist Health Castle, located in Hawaii, is a Malcolm Baldrige National Quality Award winner. They have very low patient fall rates, infection rates. They have high engagement scores, and they perform well for the healthcare's value-based purchasing. But they also focus on community. They're incredibly invested in their community, whether it's a Christmas tree lighting, which may not seem like something related to healthcare. It's showing that tangible love about the community as a whole. Next slide, please. South Central Foundation is located in Alaska, and they are also fantastic, a 2-time Malcolm Baldrige Award winner. They are supporting long-term change through their community relationships. They're in relationship with both their customer owners, which is what they call their patients, and then the community as a whole. And they lead with those values, which is another key factor here. And every time they do anything, they say, does this tie back to our goals? And does this tie back to what the community wants? Whether it's opening, I can't remember if it's a coffee shop or a canoe, they have everything that may be seemingly unrelated to their task at hand actually is very related. So they get there through understanding values, culture, and dynamic. Next slide, please. So these next ones we're just going to highlight very quickly. Voice Love, Gabriela Pelin is on the call now. We love, love, love them. And they're a tool to keep in touch with people while they're hospitalized, which can help reduce rates of delirium, and which has a tremendous cost. It reduces staff burden and keeps everybody connected without having to need a third party. It's a fantastic, fantastic system we're super excited about because it is very passion driven. Empathetics is founded by a Harvard psychiatrist. She's the chief medical officer of Empathetics now. And it's in a 3-hour training. They've been able to reduce or create a 17 times retention rate and an $18 million savings just by helping providers understand how to become more empathetic, which is something that doesn't seem like it's going to translate to a multi-million-dollar impact, but it really does. Next slide, or I'm sorry, Joyous. So Joyous, best decisions with the best data, and they have everything. They share their staff and their leadership come together. They get feedback from everybody, and they do it in a very tangible, small way so that everything can be acted upon. There's not a massive survey so that people have all this stuff and it gets lost. They say, what are the issues? They identify these with the people who matter, and then they take action on them. Envision Kindness is a really interesting organization because it shows images of compassion and love to people. And even by seeing these, they've impacted Press Ganey scores in a really, really tangible way, showing that patients have better results and they have better ROI. It reduces the whole, I can't really come up with a good way, but the whole negative feeling for everybody to the point that it results in tangible results. Next slide, please. ChenMed, they are remarkable. It's a full risk organization. They have a high risk population and aging population, and they focus on everything from including the way that they speak to people from high risk, calling them instead of walk-in patient, a patient in need, which can activate that love-based thing. But they also spend a tremendous amount of time with their patients, seeing them every month for, I think it's an hour each day, but hour each month, but getting to that heart of people and understanding who they are without worrying about, okay, it's this condition. Who are these people and how are we impacting them? Upstream works a lot on, they reduce admin burden. They help a lot with prescriptions, helping people understand why they're taking something, how it's impacting them, and then understanding if they're not compliant, why that is. And they can, sometimes it's as simple as changing the time of day that a medication is taken. Similarly, Patient Pal does a white glove service for the patients, helps them coordinate care when you often feel lost or confused. It's the last minute that you all of a sudden have to do all this. They're that person to hold your hand. And finally, MUSC, one of our favorite loving organizations. I've personally been treated by them. My whole family has, and they rethink everything at every turn. Their head of pediatric neurology took their wait time from 9 months to just a few weeks with simple things by looking at the way that the workflow is working, allowing people to practice at their highest levels rather than just seeing the MD all the time. She works in the practice regularly, so she sees patients, so she knows what's happening. And just being able to ask questions. They have a culture of empowerment where people can say, is there a reason that we're doing this in a respectful way? And they let them make those changes, going back to the values that Apurv said of trust and respect. You have that for them. And in their children's hospital, when they were building that, they were putting the technology in, and they actually stopped the whole meetings about tech and said, wait, let's go do this. They reevaluated, watched rounds, and then worked with their EHR system provider to create a new system so that they can all look at the same thing, so that everybody's seeing one particular thing and everybody's looking at each other rather than doctors looking at their iPads, patients looking at each other, looking at a thing, looking at the doctor, nobody's making eye contact. So it's been remarkable. So thank you so much for being here, being part of this, and I'm going to turn it over to the next speaker, unless somebody has questions.
Yeah, so I actually see 2 questions here. So I think some questions may not be coming through from LinkedIn, and I don't know from which channel, but thank you, Grace, for helping to display them. So I will show one from Kelly Lansman. What about high-performing teams?
I think we can learn from them when we have that. And a lot of times when we see people that are high performing, you go in and it's the trust. They're not feeling stifled by red tape or a million to-dos. You give them that respect that they can operate within their system and that you trust them as a person. You trust that they're doing the right thing for the patient or for their teammate. And we usually have a lot to learn from them because that is what we're seeing. Those are loving organizations. It's an anomaly in most cases if we're going to see a high performing team without having that kind of positive infectious effect the whole way across.
Yeah, and I'll just jump into that, Stephanie, if you don't mind. That high performing teams is absolutely, I think, one of the most important interventions that we can make. And I think I see Jeff Smith here, my mentor on this. I don't know if he'll be able to comment on this, but I encourage all of you to connect with him because he's taught us, both Stephanie and I, so much about high performing teams. But the point is that that groups of people working together. Really at the level on a day-to-day basis is where you really can feel the love and compassion. And again, I don't want to steal Jeff's thunder because I'm just kind of parroting what he's taught me. Is that in some cases even the organization might be too large of a unit in which to kind of drive the change of love. So really, to some essence, Kelly, to your question. And to Jeff's points that he's been making, I think the real intervention of love is really going to be at the team level. It just needs to be supported at the overall organizational level. Jeff, please keep commenting in the chat if you can to support that.
I would like to say just one quick thing before we leave this question. You're only going to get what the systems and workflows deliver, and the only place you're going to have high performing teams is in good systems. So that's why always, taking a look at the system first as basically what has to be looked at, what has to be upgraded, what has to be worked on in order to actually put people in a position where they can perform at a high level. So anyway, that's my speech that I give all the time.
Okay, I think we can move on. Maybe we can address this question because it's a pretty big question here. So let's just move on to the next speaker, Gabriela.
Yes, hello everybody. Thank you for having me. I'm very excited to be part of this initiative. I'm the CEO of Voice Love, and Stephanie, thank you for already giving background on my company that is trying to uplift patient spirits and connect them to their loved ones and their communities. I met Apurv and David through my work with Voice Love, and I met Stephanie as well. And when they told me about a loving organization, I was very excited. I've been in business for a long time. I worked for large companies like IBM for 15 years, and then for small companies like Avenir Health, which was a startup. And businesses struggle to make the environments at work loving, nurturing, and caring. And in healthcare specifically, the friends that are doctors that I work with now on a daily basis, there are so many complaints, there is so much hurt as to how they feel, how they are treated at work. And I thought that this initiative was absolutely needed and it could really help people. And that's why I joined. And what I'm going to tell you about today is how we're going to make it practical. I think somebody already asked that in the chat. So I'm glad that we have this topic, and we can move to slide 1. Apurv talked earlier about our mission, vision, and identity of love and inclusiveness, collaboration, and participation from a larger audience to germinate ideas. Because of this mission, vision, and identity, if we go to the next slide, there is a logic here how we go from that and from our values that Apurv talked about of community and committing to operate together, committing to hear each other, to elevate each other, how we translate that into a collaboration through committees and team, have monthly town halls and crowdsource on everything. Because this, we believe, will encourage diversity. And also, on the other hand, if it's crowdsourced, if many people have participated in it, it means the adoption will also be higher. And adoption is very important because the more organizations do this, the others will follow. And especially it's true in healthcare. If we have enough examples, then other companies would want to follow this. And if we move to the next slide, what are we going to be doing in this consortium? I know many of you probably wanted to ask this question. So we have identified 4 areas of focus for this consortium. Thought leadership is the first area. And when David and Apurv were presenting their slides and what they've learned through their careers and the work they've done, they kept saying that we really need all of yours input into this because we want to open it up in a similar model like you see in the software industry, where people building open source software, so-called. What that means is that anybody can contribute, and if their contribution is up to the standards, it's included in the main product. And then they have this joy for life that they've helped something like to develop a great product. So the same is here, contributing to the thought leadership. We'd like to open this up. We'd like to open up everyone's contribution to definitions and standards. What is a loving organization? How do we define this? And then how do we evolve into creating standards around that, into publishing annual reports around the state of a loving organization? And eventually, we'd like to be able to publish those standards in a few years from now. It usually takes work. If we look at other industries, how long it took them to develop standards, it's between a year or 2 of joint work that it takes. And eventually, when those standards get published, after that, what we could do is have a certification service that companies who want to be called loving organizations, they can be certified if they wish. I think this could be very impactful in the market, and education services around that could help people understand what does it mean. Like if somebody wasn't involved in the consortium and they came in later and they wanted to understand the standards, or they want to understand the work that we've done, we could offer those education modules. And the awareness and promotion that we've already started on LinkedIn and through our beautiful website. I hope you had an opportunity to look at what we've created there. And Natasha, who is on the call today, helped us with that. And Priti helped create our LinkedIn page. And we have all of those things up and running. And we're looking for more volunteers to help us with that. If we go to the next page, the teams that we have right now, and many of you have talked to Apurv or David in one-on-one meetings. Right now we have the Catalyst team, the people that you're hearing from today on this call. And each one of us has done work to get this event together, to put together this presentation that we will make available to the participants after this event. And David, Apurv, myself, Priti, Natasha, Stephanie, and Kristen is part of the Catalyst team that will be meeting regularly. We also have our charter members that have coordinated with Apurv or David, and they know who the charter members are. And we have over 20 individuals in that group, and strategic advisors that we thank them very much for all of the advice that they have given us. We'd like to have a category of general members, and what that means is people who might not even be able to put hours into this, but who are very interested and would like to use this information and to implement that in their own businesses. And the way we're going to implement it is through executive committees. And if we can go on the next slide. The 4 executive committees that we'd like to put in place right now with your help is on governance, on operations, on membership engagement, and thought leadership and marketing. And we have some of the people who have already raised their hand, and I will show you that in a second. But before I go to that, I'd like to reiterate again that our model is crowdsourcing, and even the management of the consortium is open to all the members of the consortium. And if any of you would like to participate in the governance, operations, membership engagement, or thought leadership committees, you're very welcome. Once the governance and operations committees will finish their work, then the previous slide that was showing you the teams might naturally evolve into some other structure, whatever is going to be decided through the work of those governance and operations committees. So we're starting with a structure that we've put in place, and we're open that the structure could evolve. And what's important for us is for the operations team to put together a way for us to crowdsource content, because there's going to be many individuals who would want to contribute to what a loving organization actually is, and we need technology and we need ways how those contributions can be implemented and heard from everybody. And once we have those processes defined, we will all start collaborating and crowdsourcing what a loving organization is. And on the next slide, we have people who raise their hands. So thank you so very much. And so we have some starting point for those 4 committees already. And we're looking for more members to participate here. And on the next slide is how you can help. So how you can help. You can react to what you've heard today, and we will send you the chart. You can reflect on this and determine at what level of effort would you like to be involved. You can volunteer to join a committee to help crowdsource the management of the consortium, and later on crowdsource what a loving organization is and how do we get to those standards. And you can help by spreading the word, by sharing the work of the consortium within your organization. Henrietta, that's it from me.
Yeah, okay. So I will show, we have one question that I will put up. So as one moments of experience, once we identify our pockets of brilliance, we model them and have to answer only one question. How do we make more teams like our best teams? Anyone who wants to take this question?
Yeah, I think that moments of experience is Jeff Smith. It's not coming across. This is his company and his vision, and he's the individual I mentioned earlier who's taught me so much about leadership. And I think this is a little bit more of a rhetorical question, if I'm not mistaken, in that this is his point: is study the teams, understand where our so-called positive deviants are, and try to understand what's making them really work well, and then to try to find a way to emulate that. So that goes back to Kelly's question of high-performing teams. Kelly had a subsequent question, which is this an emergent property of loving organizations? I think that's true. High-performing teams emerge out of a loving organization, but I think it's also bidirectional. In that high-performing teams help to create a loving organization, right? So it's a naturally a cyclical process. I think we're all just recognizing the impact that getting a small group of people together that work together every day can have on the impact of the culture of their unit, on their environment, on their department, and ultimately can build up to the overall organizational level. So a lot more thought process and debate we can have with all of you around, is the team the right unit to focus on, or is it the organization, or is it both? Again, ultimately, we thought that the organization really makes sense as the unit within which we can propagate a lot of these ideas. Organization has a structure, it has mission, vision, values, it has purpose, it has some determination, and I think it really, even though it's also operating within a milieu and an environment within it, which it could say, well, we don't control the regulations, we don't control the payers, we don't control the insurance companies. That's all true. At the same time, there are a lot of elements and variables that an organization can control, part of which is the opportunity to create these loving teams. So, again, this is an opening salvo, so to speak. We look forward to speaking with more of you to continue to think about how does this actually get operationalized and rolled out.
And a great question also from Kelly Landsman. Is this work in alignment, collaboration with IHI or other clinical orgs? I meant to say during my presentation that we're also looking for ideas how to partner with other organizations and how to link into other beautiful work that people are doing. So Kelly, really appreciate it. We will certainly consider this alignment and who we can partner with.
Thank you. And the last one is from Brief Coaching again. Suppose we design even the structure of this consortium with love. What might that look like? Who wants to take this?
So that would be something that the governance and operating team will work on. And obviously, we don't know the answer to this question ahead of time without meeting together and talking about this, because that's a key question, and that's exactly what we'd like to achieve.
Yeah, I would say I agree. I mean, I think, again, hopefully it's a thought-provocative question with which we cannot answer in terms of structure, but we do know in terms of principles that that's what we aspire to. We want the consortium to be loving. We would like to be, self-governing. Again, we don't want this to be hierarchical. We want to ourselves operate with love, treat each other with love, help to identify where there may be even potential conflicts that we can keep coming back to love. The more that we ourselves can learn more about love and become more loving, I think that the consortium will be more loving and vice versa. And I think then we really have a tremendous potential working together to help shift our healthcare organizations into the same mode.
Okay, there is also a question about how do we get in touch, but from Jennifer. But they will just talk about it now, the next presentation, so we can move on to Priti and Natasha.
Hello, everyone. Sorry, I had to rejoin, so hopefully you can hear me okay.
Yeah.
Let me know if not. And it's fortunate I'm presenting with Natasha, so if I do get disconnected, she can pick up the entire thing. My background is I'm a physician, researcher, and entrepreneur, and been working at the intersection of healthcare and technology for 20 years now. The one common factor that we always see, whether it's like implementing or optimizing or trying to bring any change to an organization, is the fact that there needs to be a way to assess and measure and monitor. And that was one of the reasons for co-founding DashTech, where I'm currently a CEO and working on strategies for optimizing the use of data within organizations. That was one of the ways I got connected with Apurv and involved in a loving organization. So really excited to be here at this moment. And I know a lot of questions have come up about, well, how do we get in touch? There's a lot that we're still evolving. The consortium is taking shape and growing. So there's a lot we will continue to do over the next months and years. I'm sure wonderful things. But two parts that we knew we had to do to get started was start to build the community and to start sharing information. So this live stream is one example, but if we move to the next slide, Henrietta, our website is up and running, lovingorganization.com. So you can visit that. It's the starting of the website. We'll be adding a lot more, but you can start seeing case studies and other resources available there. There is also a quiz on the website. If we go to the next slide. The quiz, you can take that quiz, and that will help just start showing the beginnings and the initiation of how we are starting to think about the assessments and the insights and reports that are available. There are also contact details on the website for you to connect or send information, just send questions, comments there. Another way you can connect with us is on LinkedIn. Next slide, please. And on LinkedIn, we do have our page, a Loving Organization Consortium, that if you aren't already following, please do follow. We're pretty active in posting, not just on the consortium page, but from the members that you've heard from today. So feel free to follow the page, feel free to connect, comment on that. And as more avenues become available, we'll be sharing those with you as well. I would also like to invite Natasha to talk about one of the first, I think one of the first conferences where a loving organization will be highlighted. Natasha, do you want to speak about breakthroughs?
Sure. So I work at Premier with Apurv, and our big conference of the year that we put on for our healthcare members is called Breakthroughs. And this year it's in Washington, D.C. It is next week. And we're going to be featured at our DEI booth. We will be there on Wednesday, July 24th, all day long, except for we take a break in the middle, but we'll be there pretty much all day, except for a short break in the middle of the day. And we will have, I don't know if any of you guys have ever attended Breakthroughs, but it's a huge conference. It's for 3 days. We invite our member organizations to come. We talk about Premier Solutions, but there's also lots of breakout sessions that they can earn CE credits. There's lots of really interesting, innovative ideas and conversations going on. And we're super excited to have this opportunity to showcase a loving organization. We're also going to have a scientific poster so Premier has a part of the business that's Premier Applied Sciences. And so we will also have a scientific poster that will be part of their poster reception. And it's based on a case study that we did at Maine Health. A few months ago, we finished our pilot project at Maine Health, and we created a case study based on that. And then later this year, we do plan on submitting a scientific poster to a IHI through Premier. So that's just some exciting things. This is kind of inside Premier and outside Premier effort. So that's just some things going inside Premier as far as a loving organization goes.
Great, thank you. So back to you, Henrietta.
Yeah, so I don't see any new questions in the chat. I just would like to say that thank you so much for everyone who participated today, the audience. We have had a very good turnout and so many supportive and loving comments, and many people interested in joining this project. So I think it will be very, very exciting. So I don't know if there is anything, just briefly, something that the speakers want to address. But if not, then we can just move into wrapping up. So David, please make your conclusions.
Yes, Henrietta, could you put the one slide up that Gabriela had about actions that can be taken? Okay. Well, first of all, before I go into how you can help, to kind of conclude the live stream today, I just want to ask you a question. Have we told you how much we love you today? We love you so much. I'm sorry, I couldn't help myself. Okay, so let's take a look at actions that we can take going forward again. So, certainly you can look at joining the consortium and participating in any way that you want to participate. You can volunteer. I think a big one is that anyone can do is spread the word. Let people know that, we're here, that we exist. that we are in the process of creating a movement for the transformation of healthcare from being fear and control based to being loving and caring based in a systematic way. And I think that's the last thing I would say is that I think keeping in mind that we are only going to get what the systems will deliver, whether it's leadership and management systems and workflows and policies and that sort of thing, or whether we're actually delivering care to patients and taking good care of them. So, we have to look at always keeping in mind that taking a systematic approach to whatever it is that we're doing is going to probably be the best way to move things forward, because that way we'll be aligning both the love that exists in each and every one of us with the systems which are producing the outcomes that we want, which will be based in love and caring and compassion. So with that, we'll conclude our love stream and just say thank you for coming and for participating and for sharing the essence of who you are with us. Thank you.
Thank you, everyone, for the wonderful presentations and comments. And I'm very excited myself to see this consortium unfold. And so presentations can be requested from the speakers and through the website. And the recording of this live will also be available on LinkedIn and on YouTube. So thank you very much.